Dr. Sully here with Sullivan Dental Partners again, and what can I eat or not eat after I've had my big hybrid all-on-4 surgery? So that's a great question. That's obviously very common. What we really recommend is we're going to recommend a pretty soft diet for the first couple weeks. Now, what does a soft diet mean? Generally what I say is you need to be able to cut this with a fork or a spoon. If you're having to use a knife to cut something, that's probably more difficult or hard, and we don't necessarily want that. The reason being is that for the first 8 weeks, the implants are healing. And when the implants go in, they get primary stability based off the bone quality that you have, but they're actually going to integrate on a cellular level with the bone. That's kind of the unique thing about implants. And so the stability starts out pretty high. It's going to drop over the next 8 weeks until it gets better, and then it'll be pretty stable because it's actually going to integrate with your bone. And that whole biological process takes about 8 weeks. Once we get to that 8-week mark, we can start to eat a little more foods. We're really trying to get to that 3-month mark. The 3 to 4 months is where now all of a sudden the implant should be fully integrated. And so unless you have some sort of medical problems or you're immunocompromised, by that point the implant should be integrated and you'd be good to go. But during that process, no crunchy foods, no hard foods. Again, if you have to think twice about it, it's probably not a good. And of course, if you have questions, you can always ask us and we'll give you a recommendation. But it's definitely going to be a good time to enjoy some of that Southern cooking, mashed potatoes, green beans, mac and cheese, all that stuff that we like here in the South. Those are some good things that probably will make it worthwhile. Smoothies, milkshakes, those are going to be really good for those first couple weeks. We just want to be careful because if something happens in that first time and we lose an implant, we do have to start that process over again. And so we want to try to avoid that, and taking extra time and precaution through those 8 weeks is ideal.